ਫੈਡਰਲ ਸਰਕਾਰ ਵੱਲੋਂ ਬੁੱਧਵਾਰ ਨੂੰ ਇਹ ਐਲਾਨ ਕੀਤਾ ਗਿਆ ਕਿ ਇਸ ਮਹੀਨੇ ਦੇ ਅੰਤ ਤੱਕ ਯੋਗ ਬੱਚਿਆਂ ਲਈ ਕੋਵਿਡ-19 ਵੈਕਸੀਨ ਦੀਆਂ ਵਾਧੂ ਡੋਜ਼ਾਂ ਉਪਲਬਧ ਹੋਣਗੀਆਂ। ਇਸ ਤੋਂ ਇਲਾਵਾ ਪ੍ਰੋਵਿੰਸ ਤੇ ਟੈਰੀਟਰੀਜ਼ ਨੂੰ 140 ਮਿਲੀਅਨ ਵਾਧੂ ਰੈਪਿਡ ਟੈਸਟਸ ਵੀ ਡਿਲੀਵਰ ਕੀਤੇ ਜਾਣਗੇ। ਪ੍ਰਧਾਨ ਮੰਤਰੀ ਜਸਟਿਨ ਟਰੂਡੋ ਨੇ ਆਖਿਆ ਕਿ ਪ੍ਰੋਵਿੰਸ ਤੇ ਟੈਰੀਟਰੀਜ਼ ਵੱਲੋਂ 35 ਮਿਲੀਅਨ ਰੈਪਿਡ ਟੈਸਟ ਦੀ ਕੀਤੇ ਗਏ ਹਨ ਅਤੇ ਇਸ ਮੰਗ ਨੂੰ ਫੈਡਰਲ ਸਰਕਾਰ ਵੱਲੋਂ 4 ਗੁਣਾ ਕੀਤਾ ਜਾਵੇਗਾ।
We need to do our part. And if you haven't yet gotten vaccinated for whatever reasons, know that there is a vaccine for you waiting at your local pharmacy or your local health center. We have all the vaccines we need for all Canadians, so please get yourself vaccinated. That's how we keep our health systems from getting overwhelmed. That's how we minimize the impact of COVID on our society, on our economy, on our neighbors, and on our frontline workers. We're also continuing to send tests, rapid tests, to provinces and territories. We delivered a record number of tests in December. We're going to quadruple that in January.
Rapid tests are proving to be an important tool to help us Canadians reduce the spread of Omicron. Before December 2021, our government had delivered 85 million of such tests to provinces and territories. In December 2021 only, an additional 35 million tests were delivered to provinces and territories. Today, I'm pleased to confirm that an additional 140 million rapid tests will be delivered to provinces and territories in the month of January. As requested by our colleagues from provinces and territories, these tests will be allocated to them on a per capita basis. These 150 million new rapid tests for January represent 3 times the December delivery of 35 million tests. Deliveries are already well underway, and we will keep you posted as often as possible. Across Canada, all levels of government are doing their best to help slow the spread of this virus and support Canadians. These are challenging times, but they will not last forever. We have the tools we need to get through this new wave of the pandemic. Let's continue to exercise caution.
ਪ੍ਰਧਾਨ ਮੰਤਰੀ ਜਸਟਿਨ ਟਰੂਡੋ ਨੇ ਆਖਿਆ ਕਿ ਇੱਕ ਵਾਰੀ ਫਿਰ ਤੋਂ ਨਵੀਆਂ ਪਾਬੰਦੀਆਂ ਲੱਗਣ ਤੇ ਹਜ਼ਾਰਾਂ ਦੀ ਗਿਣਤੀ ਵਿੱਚ ਸਰਜਰੀਜ਼ ਨੂੰ ਮੁਲਤਵੀ ਕੀਤੇ ਜਾਣ ਦਰਮਿਆਨ ਕੋਵਿਡ-19 ਵੈਕਸੀਨੇਸ਼ਨ ਨਾ ਕਰਵਾਉਣ ਵਾਲੇ ਲੋਕਾਂ ਤੋਂ ਕੈਨੇਡੀਅਨ ਖਫਾ ਹਨ। ਉਹਨਾਂ ਕਿਹਾ ਕਿ ਇਸ ਸੰਬੰਧ ਵਿੱਚ ਕਈ ਤਰ੍ਹਾਂ ਦੀ ਕੈਂਪੇਨ ਚਲਾਈਆਂ ਗਈਆਂ, ਲੋਕਾਂ ਨੂੰ ਸਿੱਖਿਅਤ ਕਰਨ ਲਈ ਹਰ ਹੀਲਾ ਵਰਤਿਆ ਗਿਆ, ਲੋਕਾਂ ਦਾ ਹੌਸਲਾ ਅਫਜ਼ਾਈ ਕੀਤਾ ਗਿਆ, ਵੈਕਸੀਨੇਸ਼ਨ ਦਾ ਸਬੂਤ ਲਾਜ਼ਮੀ ਕੀਤਾ ਗਿਆ, ਪਰ ਇਸ ਸਭ ਦੇ ਬਾਵਜੂਦ ਅਜੇ ਤੱਕ ਸਾਰੇ ਕੈਨੇਡੀਅਨਸ ਵੱਲੋਂ ਟੀਕਾਕਰਨ ਨਹੀਂ ਕਰਵਾਇਆ ਗਿਆ।
The vast majority of Canadians have stepped up, have been there to get themselves vaccinated, to protect their loved ones, to protect frontline health workers, and that is significant. We're amongst the top countries in the world in terms of citizens stepping forward to do the right thing. So it's not just about governments and health workers frustrated that there are Canadians who still continue to choose to not get vaccinated. It's fellow Canadians as well. When people are seeing cancer treatments and elective surgeries put off because beds are filled with people who chose not to get vaccinated, they're frustrated. When people see that we're in lockdowns or serious public health restrictions right now because the risk posed to all of us by unvaccinated people, people get angry. And we have put forward many, many different measures to encourage, to reassure, to incentivize, to educate, to cajole, to remind people that it's never too late to do the right thing. It's never too late to go and get your first dose of vaccine. I can tell you that that frontline health worker who's giving you your first dose of the vaccine, even now in January 2022, will be immensely pleased to be able to give you that first dose of vaccine even today, because they'd much rather be giving you an injection of vaccine than intubating you in an ICU. We need to continue to do the right thing the way all Canadians, or the vast majority of Canadians are, keep each other safe, and make sure our country gets back to the things we love as quickly as possible.
ਅਲਬਰਟਾ ਦੀ ਸਿੱਖਿਆ ਮੰਤਰੀ ਨੇ ਘੋਸ਼ਣਾ ਕੀਤੀ ਕਿ ਕਿੰਡਰਗਾਰਟਨ ਤੋਂ ਗ੍ਰੇਡ 12 ਦੇ ਸਾਰੇ ਵਿਦਿਆਰਥੀ 10 ਜਨਵਰੀ ਤੋਂ ਇਨ ਪਰਸਨ ਲਰਨਿੰਗ ਲਈ ਸਕੂਲਾਂ ਵਿੱਚ ਵਾਪਸ ਆ ਜਾਣਗੇ। ਉਹਨਾਂ ਨੇ ਇਹ ਵੀ ਘੋਸ਼ਣਾ ਕੀਤੀ ਕਿ ਸਰਕਾਰ ਓਮਿਕਰੋਨ ਵੇਰੀਐਂਟ ਦੇ ਪ੍ਰਸਾਰਨ ਦੇ ਜੋਖਮ ਨੂੰ ਘੱਟ ਕਰਨ ਲਈ ਸਕੂਲਾਂ ਵਿੱਚ ਰੈਪਿਡ ਟੈਸਟ ਕਿੱਟਾਂ ਅਤੇ ਮੈਡੀਕਲ ਗ੍ਰੇਡ ਮਾਸਕ ਵੰਡ ਰਹੀ ਹੈ।
Over the past several days, my team and I have continued to work closely with school authorities. I'm extremely grateful for their input, and I'm so pleased to confirm that ECS and kindergarten to grade 12 students will return to classrooms on January 10th. Children who learn in person belong in the classroom, and they will be there with the added safety of rapid tests and medical grade masks. These will be distributed to schools as an added layer of protection to lower the risk of transmission of the Omicron variant. The government will begin distributing shipments of rapid tests and masks later this week, and all schools will have their initial shipments by the end of next week. Distribution to students and staff will occur as individual schools receive their supplies, and both rapid tests and masks will be shipped in phases. This is on top of the many significant health measures schools already have in place, such as vaccine policies for staff, masking, distancing, and enhanced cleaning measures. In making this decision, we looked very carefully at information from school authorities, as well as health data. We also considered other jurisdictions in Canada who are doing similar things, such as BC and Manitoba. I also want to point out that many other places around the world have been committed to keeping schools open for in-class instruction, with additional measures in place. Take New York City, for example, where students spent last year learning online instead of in person. This year, they are very determined to remain in the classroom, despite the Omicron variant surge. Experts across Canada and around the world continue to stress the importance of in-person learning to the overall health of our children and our youth.
ਟੋਰਾਂਟੋ ਦੇ ਮੇਅਰ ਜੌਨ ਟੋਰੀ ਨੇ ਟੋਰਾਂਟੋ ਵਿੱਚ ਇੱਕ ਟੀਕਾਕਰਨ ਕਲੀਨਿਕ ਦਾ ਦੌਰਾ ਕਰਨ ਤੋਂ ਬਾਅਦ ਪੱਤਰਕਾਰਾਂ ਨਾਲ ਗੱਲਬਾਤ ਕੀਤੀ। ਉਹਨਾਂ ਇਸ ਦੌਰਾਨ ਲੋਕਾਂ ਨੂੰ ਜਲਦ ਤੋਂ ਜਲਦ ਟੀਕਾਕਰਨ ਕਰਵਾਉਣ ਲਈ ਪ੍ਰੇਰਿਆ ਅਤੇ ਨਾਲ ਹੀ ਉਹਨਾਂ ਨੇ ਲੋਕਾਂ ਨੂੰ ਮਾਸਕ ਲਾਉਣ ਅਤੇ ਪਬਲਿਕ ਹੈਲਥ ਗਾਈਡਲਾਈਨਸ ਦੀ ਪਾਲਣਾ ਕਰਨ ਦੀ ਵੀ ਅਪੀਲ ਕੀਤੀ।
If there's one thing that we can be doing as a city that is going to help keep people healthy, it's going to help to get the schools open faster and to get things on the up and up with respect to this Omicron variant, it is to get people vaccinated. And so Team Toronto continues as a top priority of ours with that effort. And this is a good example here at Seneca College of a partnership between the North York General Hospital, which, as you might expect, supplies the pharmacy. They supply a lot of the doctors who are here. Seneca College has supplied us with a great facility in which to have a clinic, as well as some of their nursing students who are helping out, and others. So we've got a great partnership here that is going to see to the vaccination of hundreds of people every single day. And you can make an appointment through the Team Toronto, through North York General Hospital. But our efforts are going to be devoted to making sure that we maintain city services, but also at the same time that we continue to ramp up our vaccination efforts so that we can keep people safe, so that we can give people the maximum amount of protection in terms of their own health, and so that that will help for us to get the schools back open, to get the businesses back open, to have the economy of the city start to come back, but most of all to keep people safe and healthy. I want to just really tell people how gratified I am and how thankful I am to them for the fact that we're making so much progress. And yes, my thanks go to Team Toronto and all the different organizations, including our own clinics, including the clinics run by the hospitals like this one in partnership with Seneca, others that are run by community health organizations. But the clinics wouldn't mean very much if people didn't show up to get vaccinated. And we're just so gratified at the fact that 880,000 people so far have shown up to get a booster shot at one of these clinics. And again, for them, It is going to provide them with the maximum amount of protection that they need to have for their own health and the health of their families and the people they live and work with. But also it is going to move us further along that road to making sure we can get out of this nightmare we're in, get the schools open again, get the kids back to school, get people back to work, get the restaurants open.
ਕੰਜ਼ਰਵੇਟਿਵ ਵਿੱਤ ਆਲੋਚਕ ਨੇ ਕੈਨੇਡਾ ਦੇ ਹਾਊਸਿੰਗ ਸੰਕਟ ਤੇ ਸੁਣਵਾਈ ਕਰਨ ਲਈ ਅਗਲੇ ਹਫ਼ਤੇ ਹਾਊਸ ਫਾਈਨੈਂਸ ਕਮੇਟੀ ਨੂੰ ਸੰਸਦ ਵਿੱਚ ਵਾਪਸ ਆਉਣ ਲਈ ਆਪਣੀ ਪਾਰਟੀ ਦੇ ਸੱਦੇ ਬਾਰੇ ਪਾਰਲੀਮੈਂਟ ਹਿੱਲ ਤੇ ਪੱਤਰਕਾਰਾਂ ਨਾਲ ਗੱਲ ਕੀਤੀ। ਇਸ ਦੌਰਾਨ ਉਹਨਾਂ ਨੇ ਦੇਸ਼ ਅੰਦਰ ਵੱਧ ਰਹੀ ਮਹਿੰਗਾਈ ਨੂੰ ਲੈ ਕੇ ਇੱਕ ਵਾਰੀ ਫਿਰ ਟਰੂਡੋ ਸਰਕਾਰ ਨੂੰ ਘੇਰਿਆ।
Where's the money coming from? Where is the money coming from? That's a question that people in Waterloo might be asking today after a house that was up for sale for $800,000 went for $1.2 million. A small house with 4 bedrooms. One realtor tweeted that it had gone up 100% in just 2 years. These are the questions my constituents are asking. We had a similar transaction about a half an hour south of here where a modest middle-class suburban Ottawa home listed for $800,000 went for $1.2 million. Where's the money coming from? For the $200 billion year-over-year increase in the volume of transactions in the real estate sector that occurred even while the economy was smaller than it had been pre-pandemic. Where did Canadian financial institutions get the $193 billion they lent out in mortgages since the pandemic began? At a time when wages were dropping and unemployment was rising, how is it possible that financial institutions found $193 billion to increase mortgage lending? Where did the money come from to fuel the 20% year-over-year inflation in real estate, the biggest one-year increase on record, according to the Canadian Real Estate Association? Now, some say it's just inflation. Well, it is inflation, that's for sure. But for any purchase to happen, there has to be money. And we need to know where the money is coming from. This is not a theoretical question. It has priced young people, the poor and the working class out of the possibility of ever owning a home. Many young renters have calculated that not only can they not afford a home now, but that even at their current trajectory, they will never be able to afford a home. And we are creating a permanent division in our society between the aristocracy who owns and everyone else who must rent forever, whose hard work and wages will forever go to paying the mortgages of those who own and rent to them. Where is the money coming from? That's the question Conservatives will demand answers to in forthcoming Finance Committee hearings. Today I announce Conservatives will call for the Finance Committee to return to Parliament next week in order to immediately begin studying the housing inflation crisis. Yes, we think the House committee should return early. It's time for politicians to get to work.